In Nigeria, we have a very complex, adaptive healthcare system laden with both supply as well as demand side challenges. The health sector in Nigeria is really characterized by suboptimal health outcomes, poor quality of care, but also double disease burden. So we continue to have persistent vaccine preventable diseases and communicable diseases, but also rising non-communicable diseases. On a granular level, the number to remember is that every year we lose approximately 1 million women and children in Nigeria from preventable causes. I'm sure that number has come down now, but in terms of preventable deaths, right? By preventable, I mean the fact that you do not have access to bed nets, you die. Many other African countries that have been able to meet their health MDG targets, they have been able to do that by spurring thousands of innovations. Whether it is policy innovations or mobile health innovations, product innovations, innovations in service delivery, that has been the real panacea. So that convergence platform to build an ecosystem around health innovation, to identify, nurture, scale up, and invest in health innovations is key. And I believe that the private sector is really positioned to make sure its innovation advances is transported to the health sector. A few years ago, the Private Sector Health Alliance of Nigeria, in partnership with the Ministry of Health and other stakeholders, launched the Saving 1 Million Lives initiative as a public-private coalition to focus on outcomes, on results, right? On using private sector and innovation to save and capture as many of these million lives as we can per year. I think that this is exciting, and I'll tell you why. Because we have in the past done a number of competitions. That is never enough. We were part of the Healthcare Hackathon, which was a competition that was just focused on technology for healthcare, right? But how can we do more to support our movement to save 1 million lives? So this is the journey. You see three main categories. The first is around innovation to save 1 million lives. This is around the innovation service delivery. The second is around critical enablers to save 1 million lives. Once again, we are saying 1 million lives because that's our annual target. Then the third one is some topical public health challenges that will impede us from saving 1 million lives. So you can see some of the examples of the problem statements. One of it is around universal health coverage. Certain zones in the country, this is their priority. How can we help, particularly for the underserved, create community-based health insurance schemes, whether it's the payment systems or what have you, to enable us achieve that universal health coverage. Another example is human resource for health. If you go to many north central states, on average, a health worker sees 1.5 patients a day. There is a big productivity issue. So private sector support is needed to strengthen human resource for health capabilities in the health sector. people can apply and be part of it. Whether you are NGOs or academic institutions, innovators, you're all invited to participate in what I believe is a landmark effort.